All rigorous nursing research follows the scientific method. This is a structured, objective way to seek answers and verify truth. Let us review the steps of the scientific method in nursing research. Step 1. Identify the problem. What are you curious about? Maybe patients with low health literacy are missing doses. That is your starting point. Step 2. Formulate a hypothesis. A hypothesis is an educated guess. Patients who receive pictorial instructions will have better medication adherence than those who receive only verbal instruction. You would like to test this hypothesis. Step 3 is choosing your method and tools. Will it be experimental, survey-based, or observational? Will you use questionnaires, interviews, or medical records? Step 4. Collect and analyze the data. For quantitative studies, this could mean using statistics and SPSS or any other platform to compute your statistics. For qualitative ones, you might look for recurring themes from interviews. Step 5 is interpret and draw conclusions. What are your findings? What did they show? Did your hypothesis hold true? If yes, what does that mean for your practice? This structured process ensures our conclusions are not based on bias or guesswork, but on evidence and logic. This scientific method protects the integrity of the results and enhances your credibility as a researcher. This structured process ensures our conclusions are not based on bias or guesswork, but on evidence and logic. The scientific method protects the integrity of the results and enhances your credibility as a researcher. When designing your research, it is essential to be clear about your purpose. What exactly are you trying to achieve with your study? Research can be grouped into 4 broad types based on its purpose. Use this to help us define the direction, the tools, and the expected outcomes of the study. Exploratory research helps us understand phenomena that are not yet well defined. Think of this as the getting to know phase. For example, if you want to explore how new nurses feel about transitioning into practice in COVID-affected areas, this would be exploratory. There may not be a lot of literature on it yet, but your goal is to gather insights. Descriptive research answers the question, what is happening? It paints a picture using data. For instance, you would like to know what are the common stressors among third-year nursing students during hospital duty. You gather data, maybe through a survey, and describe the trends. You are not looking for cause and effect here, just what exists. Correlational research investigates relationships between two or more variables. For example, you might want to ask, is there a relationship between sleep quality and clinical performance among nursing students? You are not proving cause, just whether these two things or variables are related. Experimental research goes a step further. It seeks to establish cause and effect. For example, does a 2-week mindfulness program reduce anxiety among nurses in the ER? You assign participants, control conditions, and measure changes. This type of research is a gold standard for testing interventions. Knowing your purpose early on guides every part of your research. From design to data collection to how you present your findings. After clarifying your research purpose, you also need to decide how you will study it. This is your approach or methodology. There are 3 main approaches in nursing research, and choosing the right one depends on your research question and the nature of your topic. Quantitative research is all about numbers. You will use structured tools like questionnaires or checklists to collect data you can quantify. For example, if you want to measure how many patients report high satisfaction after nurse-led discharge stitching, you will probably use a Likert scale. You can then calculate frequencies, means, and run statistical tests. Quantitative research is best when you are measuring specific outcomes like pain scores, blood pressure levels, the number of medication errors, or the grade point average. Qualitative research, on the other hand, focuses on meaning and experience. You might ask, how do families of palliative care patients cope emotionally? This involves interviews, focus groups, and thematic analysis. The goal is depth, not generalizability. Qualitative research is ideal when you want to understand perceptions, motivations, and emotions, things that numbers alone cannot fully explain. Mixed methods research combines both the qualitative and the quantitative research. You might start with a survey, which is quantitative, to find trends, then follow with interviews, qualitative, to understand the reasons behind the trends. For example, what is the level of satisfaction with online nursing classes? And why do some students feel more engaged than others? Mixed methods allow you to see both the forest and the trees, the big picture and the personal stories. Another way to classify research is by when the data is collected. This is known as the study's time frame. Time affects what kind of insight your study will give. There are four key types based on the time frame. Cross-sectional studies are like snapshots. You collect data at a single point in time. These are quick and cost-effective. For example, surveying nursing students today to determine their stress levels after midterms is cross-sectional. Longitudinal studies track changes over time. You collect data repeatedly from the same group. For instance, you might follow a group of patients for 6 months to see how their lifestyle changes affect blood pressure. This gives insight into patterns and developments. Retrospective studies use existing records or past data. For example, reviewing patients' charts to analyze outcomes of different delivery methods over the past 5 years. These are useful when it's not feasible or ethical to conduct a study in real time. Prospective studies follow participants forward into the future. You define your cohort and track them as events unfold. For example, enrolling first-year students now and tracking their academic performance until graduation. Choosing the right time frame ensures your study answers your research question effectively while respecting your timeline and resources. Now that we have covered the what, the why, and how, and when of research, let us talk about the where. Where does nursing research actually happen? Nursing research can be conducted in varied settings, each one influencing the kind of questions you ask and the data you gather. Clinical settings include hospitals, clinics, and long-term care facilities. Here, you can study patient care, medication adherence, procedural outcomes, or staff dynamics. For example, you might research infection rates after a new catheter protocol is introduced in the intensive care unit. Educational institutions are common settings for student-led research. You might evaluate the effectiveness of teaching methods, learning environments, or academic performance. For example, does the use of virtual simulations improve critical thinking among nursing students? Communities and homes are essential for public health and community health nursing research. For instance, studying the breastfeeding practices of mothers in a coastal barangay or exploring adolescent sexual health behaviors in urban poor areas. Virtual or simulated environments are becoming more relevant, especially post pandemic. You can now conduct surveys online, host focus group discussions via Zoom, or use simulation labs to test interventions like emergency response training using mannequins or virtual reality. Each setting has advantages and limitations. Choosing the right one is about matching your question with the best environment for honest, accurate, and ethical data collection. Let us now wrap up this lecture by summarizing the key points we have discussed. First, we defined nursing research as a systematic and evidence based process that is crucial in improving nursing care. It is not just about gathering data, it is about answering real world questions and finding better ways to serve our patients, families, and communities. Second, we explored how research can vary in terms of purpose, approach, time frame, and setting. Whether you are conducting a quick survey, a long term follow up, or an in depth interview, the method you choose depends on the kind of question you want to answer. And finally, we emphasized how research empowers nurses, not only to solve problems in clinical practice, but also to advocate for policies, improve systems, and advance the nursing profession as a whole. This is just the beginning of your journey in your academics and in your research journey. But I hope you are starting to see that research is not separate from nursing. It is within the heart of it.